Good morning, ladies and gentlemen. The topic of today's lecture is Acetratin in Dermatology. I am Professor Ashar Ahmad Mashood, and if you are watching my video, please subscribe my channel. Introduction. Acetratin is a synthetic retinoid, which are the vitamin A derivatives that has been used for up to 20 years now and has completely replaced atritinate, which was the first retinoid that was introduced, owing to its shorter half-life than atritinate. The recent evidence suggests that some of the drug is reconverted to atritinate, especially if combined with alcohol. Though its action on steroid, thyroid hormone superfamily nuclear receptors, it interferes with epidermal cell proliferation, differentiation, and cornification. Hence, its use in epidermal hyperproliferative conditions like psoriasis. It has also been shown to exert some immunomodulatory effects on the skin. The cost, monitoring, and patient education awareness are some of the factors which would restrict the use of Acetratin in Pakistan. Since we do not have a governing body to monitor the dispensing, use, and monitoring of Acetratin, therefore, the responsibility of all the side effects and their management and their prevention rests at the shoulder of treating physician. Interaction. Indications of use of Acetratin. Psoriasis is the number one indication for which Acetratin is used. There is best evidence for efficacy of Acetratin in pustular psoriasis and erythrodermic psoriasis. However, the long-term high-dose therapy is required for optimal and lasting results. The optimal dose is 50 to 75 milligram daily for a period of 1 year. At least 3 months is the minimum time that you would prescribe Acetratin. If the patient responds earlier, you are not going to stop it before 3 months. In our case scenario, male patient fulfilling the criteria could be put on the treatment, but married women of childbearing age should be carefully evaluated in terms of patient's commitment, spouse consent, both partners' education and awareness level, and possibility of regular and timely follow-up visits with prescribing consultant. So, since the main side effect of Acetratin is teratogenicity, that is why it is the responsibility of the prescribing physician to discuss this side effect in great detail with the patient and the family. In case of any doubt regarding any of these parameters, patient should be offered an alternate treatment. If you think during the consultation session the patient is not reliable or the spouse is not willing, you must select an alternative treatment for that patient. Other conditions for which Acetratin is used successfully is congenital ichthyosis, keratoderma, lichen planus, especially the generalized lichen planus, PRP, pityriasis rubra pilaris, diarrheal disease, lichen sclerosis, and hyperkeratotic hand eczema. In all of such conditions, the evidence of its effectiveness is either weak or sparse. But it would be recommended to use Acetratin as the last resort treatment in male patient while avoiding or abstaining its use in female patient as much as possible. Contraindications. Pregnancy and lactations are considered to be Absolute contraindication for use of Acetratin. In our case scenario, married women of childbearing age should also be considered as relative contraindications to its use. Its used Its use should also be relatively contraindicated in children, as several reports suggest the bone and skeletal changes with long-term use that may affect the growth and increase in height of those children. Risk of Acetratin and in pregnancy and during breastfeeding. As mentioned before, Acetratin must not be taken in pregnancy as it can damage an unborn child and cause congenital disabilities, especially those of neuronal system and skeletal system. Strict birth control measures must be used during treatment and for 3 years after stopping Acetratin. People on Acetratin should not donate blood during treatment or for 3 years afterwards. Acetratin is also contraindicated while breastfeeding. It does not affect male sexual functions or the offsprings, so males of all ages can take it whether married or not. Adverse effects. Teratogenicity is the most important adverse effect. It is not dose related and is due to reconversion of acetratin into etritinate. So, strict contraception is required for 3 years after stopping acetratin. The retinoid embryopathy range from craniofacial dysmorphia, appendigeal abnormalities to meningoencephalocele. Risk is greatest in the first trimester, hence, two methods of contraceptions are mandatory. It can cause transient and reversible elevation of liver enzymes in 15% of the individual, and rarely treatment may have to be stopped or dose reduced. So, among the monitoring, liver function tests are one of the essential tests. Skeletal adverse effects range from arthralgias and myalgias to diffuse tendon calcification and hyperostosis. However, evidence suggests that these changes can occur only after 2 to 4 years of the therapy. For the same reason, Acetratin is restricted in children and should be undertaken only as the last resort with full monitoring. Headache, if these are severe or accompanied by visual problems, inform your dermatologist and stop Acetratin. The symptoms could be caused by increased pressure in the brain. So, Acetratin, like isotretinoin, will cause dryness of the lip. Apply lip salve frequently, especially when outdoors. It can also cause dryness in the nostrils, which may crust and bleed, and petroleum jelly or polyfix ointment should be applied. There will be dry eyes, so use artificial tears. Then dry, reddened skin, apply lots of moisturizer on the skin, face, as well as hands. Peeling of the skin, especially hands and feet, will occur, especially if you are treating it for palmoplantar keratodermas. Apply moisturizers frequently. It can cause fragile and soft skin and protect from injury. With long-term use, the nails will become thin, ridged, and brittle. So the thinning of the nail is one of the common side effects of Acetratin, and so is the thinning of the hair. Generalized hair shedding and thinning occur, which is usually temporary and would recover once the drug is stopped. There can be a color change and texture in the hair. There will be increased susceptibility to sunburn. So, if you are receiving phototherapy, a reduction in dose is necessary. Skin infections, especially with Staph aureus like impetigo, boil, and nail fold paronychia, may also develop. Muscle and joint and bone ache, especially after exercise. So reduce exercise if needed. Hyperlipidemia, which are the raised fat, cholesterol, and triglyceride, which can be tested by performing the fasting lipid profile. If blood fats are too high, particularly with low fat and low sugar diet, lipid-lowering medication may be prescribed or dose of acetratin is reduced. If the acetratin is causing disturbance in liver functions, the drug should be discontinued and alternate mode of treatment should be picked up. Mood changes is one of the important side effects as high dose of retinoids may cause mood changes including irritability, aggression, and depression. Interaction with other medications. Acetratin should not be taken at the same time with following medications. The other vitamin A derivative like isotretinoin, tetracycline or one of its derivatives it is contraindicated as both tetracycline and retinoid increase intracranial pressure. It should not be taken with methotrexate, with phenytoin, and best avoided with alcohol, especially if triglycerides are high. Dosage and administration. Acetratin therapy should only be undertaken under direct supervision of qualified dermatologist. Informed consent should always be taken and kept in record. If you are not taking an informed consent, at least write it. Write a line on your prescription pad that you have informed the patient about all the adverse effects, especially once you are giving it in a female of childbearing age. Effective adult dose is 25 to 50 milligram daily. Treatment should be started at 25 mg daily and slowly increased every 2 to 4 weeks. It will take 3 to 6 months to achieve the peak response. In diarrhea disease and ichthyosiform disorder, the starting dose is 10 milligram is more appropriate. If given in children under 12 years, the starting dose will be zero point 0.5 milligram per kg, which can be increased later on to 1 milligram per kg daily. Monitoring. This should also be done under direct supervision of the qualified dermatologist, preferably the one who has prescribed the drug. In case of married female of childbearing age, urine pregnancy test 1 month before the start of therapy and every month till the duration of therapy is mandatory. All monitoring parameters need to be checked monthly for first 3 months and then every 3 months for rest of the duration of therapy. The complete blood count, fasting lipid profile, and liver enzymes are the tests that are required during the monitoring. Blood glucose need to be checked only in diabetics, and radiological assessment is not required if not required in normal patient and should only be undertaken if the patient would complain of bone or joint pains. Thank you very much for listening. And inshallah, next time I'll again join you for any one more important drug that is used in dermatology. Thank you very much for patient listening. Goodbye and have a very good day.